Finally tonight, a stark new report shows the opioid crisis seems to be deepening across the country. The Centers for Disease Control released data showing overdoses are increasing at an alarming rate. In fact, emergency room visits for suspected overdoses rose by an average of 30% in a year. William Brangham is back with more on this report. William, what did the CDC say?
Just as you described, the headline out of this report is that the opioid crisis is still awful and that it's getting worse. Remember, we lose on average about 115 people die every single day in America because of a drug overdose. What the CDC did in this report is they went to emergency rooms and they looked at how many of the people that come to your hospitals are coming because of these overdoses. And as you mentioned, 30% of the overdoses, they've seen a 30% increase in overdoses in between 2016 and 2017. And in certain places, it's been particularly bad. The Midwest was really hard hit. Pennsylvania, Illinois, overdoses were up 50% or more. Delaware up by 105%, Wisconsin up by 109%. So these are really, really startlingly high increases in the number of people who are coming in this terrible circumstances. Some states did see moderate decreases in the number of overdoses, but not nearly as dramatic as the rises.
So disturbing, and these numbers are recent, as you said, right up through 2017. So why is this happening? What do they say?
The CDC didn't really get into that. I think the argument is that it's the same part of this crisis that we've seen all along. People are addicted to these drugs. They're taking more and more of them. One of the obvious factors driving overdoses is the rise of what's called fentanyl, these additives that are added to heroin and other opioids on the streets that makes them much more potent and makes them much more likely to cause people to to have an overdose. Additionally, we've also been using more and more of this drug called Narcan, which if you do overdose, it's a drug that you can shoot into your arm or shoot into your leg, and it revives you from that overdose. So in some way, we are saving more people who are overdosing, and they are getting to emergency rooms, whereas in the past, they would have just died.
So following on that, what is the CDC saying about what can be done? What kind of interventions need to happen that clearly don't seem to be happening? I was reading earlier, they were saying that a number of these people are coming back after an initial crisis.
Exactly. ERs will see what they call repeat customers, people who are coming for multiple overdoses. And a lot of public health researchers would say an overdose and you going to the ER is this moment of opportunity. It's like a window when you can reach someone when they're in a terrible circumstance and maybe you can do some kind of an intervention there. So the CDC was suggesting that people should be started on what we call medically assisted treatment. This is methadone or these other opioid substitutes, that you might start people on those medications in the hospital. Right. But again, that's years of possible treatment going forward. They also argue that we should be giving more Narcan to family members so that if you were there at the bedside with a loved one, teach those people how to use Narcan in case this happens again. Additionally, the thing the CDC was really pressing was the importance of having someone who can shepherd that person out of the hospital and into treatment. Because too often we just bandage them up and let them go, and they find treatment if they're lucky, if they have money. And so the idea is deploy someone to go to the bedside, start a conversation with that person at that very vulnerable moment, and hopefully that person could then become a bridge to walk that person out of the hospital, literally and figuratively, get them into treatment, help them figure it out, help them figure out how to pay for it. But again, these are all relatively small interventions.
And this is the kind of thing, though, that it isn't just, it's getting them into treatment, but then it's following up on this and staying with them because...
Right, we're talking about years of treatment. This is not a broken arm that you get it fixed and have the cast cut off. You're talking about a lifetime's worth of treatment.
And very hard to do on your own without help from the outside.
Indeed.
William Brangham, so disturbing. Thank you very much.
You're welcome, Judy.
And you can explore all the stories on the opioid crisis that we've done, from the many ways it's crippling communities to new ideas on how the epidemic might be stopped. That and more in our America Addicted series.